Paige Weaver. I'm a 4th semester nursing student. Today is April 18th and it's about 8:30 in the morning, and I will be inserting an NG tube. But before I get started, I'm going to make sure that I'm in order from my doctor. I'm going to check for a deviated septum with my patient. I'm going to check for any previous head or neck surgery, and then I'm going to assess the condition of my client. Hello, Mr. Jones. My name is Paige. I will be your student nurse today. Can you go ahead and verify your name and date of birth for me? Okay, perfect. And then I would go ahead and explain the procedure to my client and telling him any ways that he could help assist me during the procedure. So I'm going to go ahead and set him up. I raise the bed up to a comfortable working position. Okay. And then I'm going to provide for some privacy. And then before I get started, I'm going to check my patient's nares, and then I'm going to have him breathe out of one nostril as I clamp the other one shut, and whichever one has better airflow, I'm going to choose that one. So for today, I'm going to be doing the right nostril. So I've already prepared my tape before. And before I get started, I'm going to measure from the tip of the nose to the tip of the earlobe, and then down to the xiphoid process, and then I'm going to go down 6 more inches. Okay, and then before I get started, I'm going to ask my patient to raise his hand just in case he ever wants me to stop. Okay, and then as soon as I get started, I'm going to ask my patient to hyperextend his neck. And then once he starts coughing, I'm going to ask him to lean his head forward and then take a couple drinks as I continue to extend the tube down. And if a little bit of coughing is okay, but if it's too much, I need to hurry up and get the tube out. And then also, as long as I don't meet any obstructions, I will be okay. And if I do, I'm going to go ahead and take it out and then lube it a little bit more. And then to check the placement of my tube to make sure it's in the stomach, I'm going to go ahead and aspirate a little bit, and then I would check the pH of that. And then I could also do an x-ray, or I can go ahead and insert .30 mils of air. Okay. I'm going to go ahead and clamp it shut again. go ahead and pin the tube to my patient's gown. I'm gonna clean my patient up and then lower him back down. And then I'm going to make sure he's in a comfortable position and make sure the call light is in reach. And then once I exit the room, I'm going to document the procedure and how my client took it and if there was any output. Okay, so now my patient has given me, my doctor has given me the order to go ahead and remove the NG tube. Before I get started, I'm going to make sure that there hasn't been any tubing for 30 minutes, and I'm going to check that there is no nausea and vomiting, and then I'm going to make sure my tube is clamped. And then I have Kleenexes for my client if he needs to wipe up his nose a little bit. So I'm going to go ahead and raise him back up. And then I would introduce myself as usual and explain the procedure to my client. Set him up. Again, I have Kleenexes to use in case he needs to clean up his nose a little bit. I'm going to go ahead and unpin. Again, making sure the tubing is clamped. And then I would ask my patient to take a deep breath. And I would make sure that my tubing is intact. Clean up my patient if he needs any of it. I would lower him back down. Okay. And then once I exit the room, I would go ahead and document how my patient tolerated it and make sure that the tubing was intact.